live at the Conrad Hotel Manila, and we just concluded the two-day National Policy Dialogue event led by the UP Manila College of Nursing and supported by Johnson & Johnson. So we are here today with members of some of our moderators and members of the panel during the National Policy Dialogue. From your left to the left side of the screen, we have Dr. TJ Robinson Moncatar of the College of Public Health. We have Dr. Annabel R. Borromeo, member of the Technical Working Group for the Comprehensive Nursing Bill. And we have from the Department of Health, the Director of Health Human Resource Development Bureau, Dr. Precho Tolentino. And we also have the Project Director of HRH 2030 and former Professor of the UP Manila College of Public Health, Dr. Feli Marilyn E. Lorenzo. And last but not the least, the Dean of the UP College of Nursing and Director of WHO Collaborating Center, Dr. Sheila R. Bonito. We are having this press conference to ensure that the takeaways from the National Policy Dialogue are disseminated across the nation, making sure that our stakeholders are informed of the recommendations resulting from the two-day policy dialogue. With us also today are members of the media. We have from the IPAO as well, collecting questions, the team of the National Policy Dialogue who have collected questions from the participants online and our participants from Zoom. We also have DZMJ Online.net and DarokTagalog.net. So to begin our questions, our first question for the panel, anyone in the panel who would like to first respond would be, what are the next steps or the main takeaway from this policy dialogue in terms of the different policy recommendations and the result of the roundtable discussions? You were able to summarize a little bit from the different members of your roundtable discussions. Maybe you could cite some recommendations that you would like to share with our audience for today. So our first question would be, as we have a lot of recommendations from the panel, is what could be improved in terms of tangible support to frontline health workers, and what improvements are needed to future-proof our health systems? Any members of our panel who would like to start off? Maybe Doc Prech from the DOH HHRDD. Yes, ma'am.
First of all, from the discussions, marami na pong problema na long-standing problems na on HRH. At ngayon, ay ang key takeaway is tuloy lang natin lahat ng efforts. Currently po, ay marami po kaming bills na nakahain sa Kongreso. So, I would also like to take this opportunity to advocate for your support sa mga bills na ito. Kasi ito po yung isa sa mga solusyon na na-identify natin. Like the salary standardization, to standardize the salaries of our HRH from the local to the national levels, and the salary standardization of public and private health workers. Also, yung ating amendment ng Magna Carta, not just for public health workers, but also for private health workers. And another po is yung pong bill that will fast-track the upgrading of hospitals. Yung upgrading ng hospitals dati po ay kailangan ng batas. So, meron po kaming bill na sinasabi na dapat DOH na lang po yung approval ng mga upgrading ng hospitals para mas mabilis po ang upgrading ng hospitals at mas mabilis ang pag-increase ng mga positions natin sa ating mga hospitals. Aside from those mga bills in workforce, tuloy-tuloy din po yung aming mga ginagawa, collaboration with SHED, on expanding the scholarships. Na nasa UHC law na po na lahat ng government-funded scholarships would have return service agreements. And it will be the DOH who will determine yung placement nila kung saan sila magre-return service. Kami po yung mag-aayos based on the need for that equitable distribution ng ating mga HRH. Yun po ay isang titingnan natin na pwedeng mag-sustain ng ating mga HRH for our local needs. Yun pong ating mga production sa ating private, nakita naman natin sa mga presentations na mas malaki po ang production ng ating mga private schools compared sa ating mga public schools. So, nakita natin na yung ating public school, ating mga SUCs at HEI, ito po yung magiging source natin. We have to increase yung scholarships kasi doon po tayo may hold. Yung pong ating mga nasa private school ay wala tayong hold sa kanila, wala tayong RSA sa kanila. So, ang tanong nga kanina, mamamanage ba talaga natin yung migration ng nurses? Kasi ito talaga yung pinakamalaking problem natin ngayon. Mamamanage ba talaga? Since napakarami po natin production, napakarami pong private school na may nurses, baka kailangan pong i-balance din yung health needs and yung economic needs. Kasi hindi po natin talaga yan pwedeng pabayaan, kailangan pong i-balance. So, we have to determine ano yung pang-local natin, ano yung pang-international natin. Kasi hindi na po natin, kailangan na po natin tanggapin. Kami po kailangan na namin tanggapin na hindi natin mapipigilan yung mga nurses na umalis, but we have to balance. Talking about resiliency, kailangan po maging resilient yung health system, yung mga ospital, even yung mga school, maging resilient po. At tanggapin na kailangan yung migration ay hindi kailangan pigilin, kundi kailangan i-manage.
Thank you po, Dr. Tolentino. Anyone else who would like to follow them up? I'd like, yes, Team Sheila.
I think in terms of the education sector, so there's a need to strengthen the reorientation of the curriculum to public health. And especially that there's so many, I think, updates needed. So with all the programs and policies, to make sure that when we graduate students in the undergraduate program, not only nursing, but of course I speak for nursing, is that we have graduates who are really fit for practice in public health settings, not only in hospital. And I think that was one of the key messages that we got from this policy dialogue. And having said that, fortunately, the curriculum naman of the BS nursing program has, I think, enough concepts, but we just have to make sure that these are really demonstrated as we have shifted to outcomes-based education, so that when we graduate these students in the program, that as I said, they're actually can be absorbed. Hopefully, there will be positions waiting as well. I think that's also one of the key messages that we got from this policy dialogue, so that the education sector and also the practice settings will actually be connected. And hopefully we'll have more chances of winning them. And the College of Nursing of UP also have leadership development courses offered with the support of the Department of Health. And that's reorienting our already public health nurses to the health systems. What are the efforts needed to ensure that we can deliver the programs that WH has. So I think I'll stop there, and I'm sure Pamela has something to say.
Lynn and then Ma'am Annabelle.
To answer the question, how do we future-proof our system so that we don't fall into the same problem we had in COVID-19 when everything was exacerbated. In terms of future-proofing, how do we make sure that we don't run out of health workers, that we panic when an outbreak comes about? One key takeaway from this policy dialogue is first to remember that we have to do things right in order to make our systems work. So what do we mean? There has been a lot of talk about retaining health workers, no, to make sure that we have enough. While we accept that they will leave and that we have to manage the migration rather than control it, there are things we can do to make sure that while we share our human resources with other countries, we have enough to take care of our own people. So how do we do things right? There were a lot of suggestions from the participants, both from the local government units as well as from national level and the organizations. Now, one is the eternal request of health workers to compensate them well and value their services. No? Kasi when they're recognized and valued, and on top of that, they are offered fair compensation, then they will stay. Second is when they're valued, they should be given non-financial benefits. No? And part of this, as we saw in COVID, was they would be given transportation so they can move about. They have housing, so when there are outbreaks, they don't have to bring the infections home to their loved ones and not be able to come back. And provide security, especially in the peace vulnerable areas. No?